CPT JJ-CPV Introduction, page 13, part 3.
Selection of procedure. Continued
Parenthetical.
parenthetical notes indicate that a code should not be reported with another code.
We'll continue that section, and the next theory says that when reporting codes for services provided, it is important to assure the accuracy and the quality of the code. Accuracy and quality, okay? We must be precise, and it has to be well documented, right? We do this
through verification of the intent of the code by use of the related guidelines.
Yeah, first is the related guidelines, the guidelines that usually come at the top of the category. What else?
Parenthetical. Parenthetical instructions are encoding resources.
The instructions in parentheses. That's what I mean. Parenthetical instructions, and the coding resources and other resources that you can have, right?
Right.
Okay. Now, I think this would be parenthetical too.
Right.
Because it's parentheses, right? Okay.
Right.
All right. So we have a little picture there, or the CPT Assistant Online, which would be another coding resource, right?
Right.
So that's what they're talking about when they say coding resources. Okay. So you have to use all the information available to you to report the right code. Okay. The accuracy and quality of the code. That's what they're telling you here. All right. That's our little theory for today. Now we're going to do a problem. Can we do the problem?
Ready, set, go.
Oh, ready, set, go. I'm sorry. Okay, CPT JJ-RVA, page 251, exercise 33, and this is a level 2 exercise, right?
Right. Surgery, musculoskeletal trauma patient was rushed to the operating room with multiple injuries.
Multiple injuries, right?
Right. Open reduction with internal fixation of intertrochanteric femoral fracture.
And
Open reduction of the tibial and fibula shaft with internal fixation was performed.
okay, so this is a surgery section on the CPT manual. It's a musculoskeletal. The trauma patient, he was in an accident, was rushed to the operating room with multiple injuries, right? There was an open reduction with internal fixation of intertrochanteric femoral fracture, the femoral fracture, and open reduction of the tibial and fibula shaft, the tibia and the fibula. Tibial and fibula shaft with internal fixation was performed, right? That is the procedure. Now we're going to count to 3, so you can pause the video and give us the CPT code for this procedure. 1, 2, 3. Okay, there are 2 codes because there were 2 procedures, right? One for the femur and one for the tibia and fibula, right? So the first code is 27244, and the second code is 27758. Okay? Did you get that? If you got it, congratulations. If you didn't get it, let's give you a couple of tips. Okay, first tip.
Level 2 difficulty.
There are
2 codes.
Yeah, we are calling this a level 2 because there are 2 codes, right? So it's a little complicated. Okay, the second tip.
Start with fracture femoral for the first code, which is the femur.
I think we changed that in the process. Yeah, we start with femur fracture, right?
Yes.
Okay, can you change it to be, because we were reviewing this and we saw that the more direct path was femur fracture. Okay, for the first code, you start with the body part and then what happened to that body part, a femur and fracture, right?
Yes.
And for the second code
starts with, we also fix that too.
Fixation? No, we didn't fix that. Let's go and see it. Oh. The second code we starts with fibula first and then fracture, right?
Yes. The tibia, and fibula.
Yeah, because we're studying the tibia and fibula. You have to choose which is the shortest path, and after analyzing, we could have started with tibia, but it's a longer path. With fibula, it's shorter. So you start with fibula and then fracture, right? And there's going to be somewhere there that the tibia is also going to be included. Okay, so those are the tips, and can you we're going to explain to you what the femur is, just in case a little anatomy. The femur is from the knee, the bone that goes from the knee to the hip, right? That's the femur. And the tibia and fibula are the two bones that go in parallel below the knee, from the knee to the foot. This is the tibia and this is the fibula. Okay, so you have an idea of what we're coding. Now, can you show the answer too? Because they need to know the answer. Go a little down.
Oh.
Isn't the answer there?
You mean the summary? Oh, wait. You mean scroll down.
There's the answer, right?
Sorry.
So the answer is there. So you have the answer and you have the tips. And so we're going to count to 3 now. So you can give us the path to these two answers. Okay, so 1, 2, 3. All right. This is the summary of the whole problem. This is the surgery section of the CPT manual, is the musculoskeletal system. The trauma patient was rushed to the operating room with multiple injuries. And what was done to the patient? An open reduction with internal fixation of intertrochanteric femoral fracture and an open reduction of the tibial and fibula shaft with internal fixation was performed. Okay, so those two things. So there are 2 codes. The code 1 through the index is found like this.
First you go to index.
Go to the index.
Then you go to femur.
Go to femur, which is the body part, the bone, right?
Right.
And then?
Fracture.
Fracture. And from then?
Intertrochanteric.
Intertrochanteric, which is the first one, the one that we have, right? The first procedure.
Right.
And what is the code for that?
27244.
Okay, now we're going to check this code in the tabular. So the code 1 through the tabular is checked like this.
First you go to tabular.
Go to the tabular.
Then you go to 27244.
Since you found only 1 code in the index, go to that code and read. What does it say?
Treatment of intertrochanteric femoral fracture.
Femoral fracture, which is exactly what we need for the first part. That's why there's an equal sign there, right? Right. To the equal sign, that means that we have double checked the first code. Now we're going to do the code number 2, right? So the code number 2 through the index is found like this.
First you go to index.
Go to the index.
Then you go to fibula.
Go to the fibula. Why not to tibial? You can also go to tibial and you could also get the same answer, but we have already experimented both ways, and with fibula is shorter. Okay, go to fibula and then go to fracture. And then?
With tibial shaft fracture.
Right. If you go through fibula, the tibial is included. If you go to tibia, there's no fibula included. That's why we chose this path. And we get how many answers?
We get 5.
5 answers. Now, we're going to show you a technique. How do you eliminate from all those 5 to look for the right one, right?
Right.
So, the code 2 through the tabular is found like this. You have to look at all the 5 one by one, right?
Right.
So you go to the tabular and then look at the first one, right?
Right. First you go to tabular.
Right.
Then you go to 27750.
Which is the first one. And now when you read, the first word that says is closed. That eliminates it because ours is open. It's not closed.
Right.
So eliminated. The second one.
Second one is with manipulation.
The 752 is with manipulation. It doesn't say with manipulation in our text. That eliminates it. The third one.
27756 percutaneous.
Percutaneous. It doesn't say percutaneous there, right?
Right.
And the next one.
27758 is open.
It's open, and ours is open. So this is the best one so far. The next one.
27759 implant.
It says with implant, which we don't have in the text, right?
Right.
So the best from all these 5 codes is the 27758 because that's the open one. That's the one we want. So that's why we go to the 27758 and we put an equal sign, meaning that we have double checked this code, right?
Right.
So the answer is 27244 and 27758. Okay? Thanks for watching. And don't forget to visit our website and also
you can subscribe to us in YouTube by clicking here for our new medical coding videos.
right in the subscribe button and the red button that says subscribe. You just click there and then you'll be subscribed to us. And what do they get?
You will get up to 3 videos every day that we make. ICD-10s, CPTs, all that is needed to pass the medical coding certification exams.
Okay, so don't forget. Just visit our website and also subscribe to our videos. Thank you.
Goodbye.
Bye.